So if you don't want your brain shrinking, you want to make sure your B12 is optimal, not just in range.
Right. Now, gosh, I mean, it's everybody that comes in. You know, they've got a family member, friend, somebody that they're looking at in close relationship that has some sort of dementia or coming up with some sort of problems like that. Parkinson's.
Or we can talk about today's subject, which is healthy aging.
You want to age gracefully and healthy. You know, you can actually, there's a lot of people that age and get very sick and run down and decrepit, and there's other ones that age and they don't have all those problems. So that's what we're going to talk about, things you can do to help.
I know we're all going to age.
Right.
It's inevitable.
Yes.
So how do we begin to start that process of healthy aging?
Well, probably the best thing to do is to find out where you are. Okay, in other words, we do a lot of lab work, and it's amazing how many people come in and you ask them, have you got any particular problems? No. And yet when you do the lab work, you find out like, okay, they're pre-diabetic, they didn't know that, or they're maybe, I've even had them that are diabetic and don't know it. So, all those, find out what's wrong. Then you can fix it.
Yeah.
And once you know, okay, I've got a problem here, whatever it is, then we can fix it.
We have people, even young people coming in nowadays, which is good.
Yeah.
Some of the younger ones are actually getting a little bit more proactive than the older.
Yeah.
And they're like, I want to see, you ask them if they have any problem. No, I just want to see where I am. Because that is the best thing to do, is to find out what your underlying issues are. Find out what your nutritional deficiencies are. Fix them before they cause a problem. And that will make you age better.
Yes.
There's no doubt.
Well, and it's possible there are some things that you may be deficient in that doesn't present with any kind of symptoms. So it's good to come in and get that checked, because you might not even know you're going down a slippery slope until it's too late.
Exactly.
Right.
And that's what we want to prevent, is that slippery slope, so to speak, because it can really, it is slippery, and you can get to a point, it's like things that are so common, like vitamin D deficiency. Mm-hmm. Oh my goodness. We see just about everybody we test has some sort of vitamin D deficiency. And not only that, B12. And there's been research after research. I mean, the University of California, San Francisco has got tons of research on vitamin B12 and how it helps the brain to keep from shrinking from aging.
Right. There was actually a study that showed, it was a really neat study, because they actually took people with normal B12 levels. Okay, they said, we want people that fall within the range, but the range is huge. We tell people we like to see it at least 800 because of some of the studies we've seen. But the range starts at like 243 and goes up to like 1200. So it's a huge range. They took people that were in normal range and they did MRIs of the brain. And what they found is, when they looked at these MRIs, that if the level was on the lower end, their brains were shrinking. And the people that were on the higher end was not. So if you don't want your brain shrinking, you want to make sure your B12 is optimal, not just in range.
Right.
So the studies have been pretty good on that one.
Yeah, and that goes along with the B12 thing. I mean, you have the brain for sure. Anything in the nervous system, and we see so many people that are developing some sort of neuropathies nowadays. Yeah. I mean, it seems like there's an epidemic of neuropathies.
Well, neurodegenerative problems.
Right.
I mean, you start looking at the neurodegenerative problems as a whole, your Alzheimer's, your Parkinson's, it's growing. It's actually on the rise. And so people, that is one of the things you don't want as you age, because it will definitely affect your life. And so we tell people, you got to start young,
Yeah.
I feel like that's the most terrifying thing, is outliving your brain.
It is. It's scary. I mean, it's huge. And there are so many people. I just had some young people come in last week and said, I think I'm at risk because of my family history. What all can we check? And that's what the kind of stuff you need to start doing young, because if you find out you have something like homocysteine. Homocysteine is a level that's on our cardiac panels because it affects the heart, but it also affects the brain. And when it's high, it is so easy to lower, because it's a genetic. It's usually from a genetic mutation, but there's a way around it. But if you know you need to do that, then you can do it. You can take methylated B vitamins and it lowers it. So there's things you can do if you start early. You don't want to wait until you have dementia or Alzheimer's. Mm-hmm. You want to do something to prevent. And that's what we always say with aging, is you got to have prevention.
Yeah, because once that neurodegenerative stuff's like Alzheimer's and so on, once it sets in, you're probably not going to turn it around. That's just, you might slow
it down, but you're not going to
turn it around.
Stop it. Yeah.
Do you have a lot? Are those cases increasing for you?
Oh yeah. I mean, we are seeing more of everything, it seems like.
I've been doing it for well over 40 years. And 40 years ago, I mean, you'd see some senile dementia, the guys in their 90s or something like that. I remember an older patient, he was like in his mid-90s, seriously. And the parking lot was full, so he just parked in the turning lane in the middle of the street. Okay, he's losing it a little bit, and the policeman came in and said, hey, whose vehicle's that out there? Well, it was him, and bless his heart, he just kind of like, well, that's a parking place. But so we didn't see much of that. Other people, you just did not see it that much. Now, gosh, I mean, it's everybody that comes in. They've got a family member, friend, somebody that they're looking at in close relationship that has some sort of dementia or coming up with some sort of problems like that. Parkinson's used to be, I mean, gosh, I can remember, like say 40 years ago, you just didn't see that. I mean, they were there. You see a case of Parkinson's occasionally, but it was rare. Now, it's rampant. Yeah,
so it's not just about the way you look as you get older, because a lot of people think of healthy aging as looking good. You also got to work on the inside, and that's what we always tell people. If you keep the inside good, you can help the outside as well.
Right. I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.